News Radio 700 WLW.
Patients of female doctors apparently live longer, research shows.
And that's interesting because you talk all the time about how your wife is actually killing you, but in this way, a female doctor might actually save your life.
Well, I think a female doctor could actually tell you what's in her brain, what's in my wife's brain.
Well,
besides the fact that
time do we have
she don't like her as me.
Right, yeah.
But anyways, that's beside the point. That's a whole different
all
issue.
of it is, yes.
But I'm just curious as to how that might be. And here to discuss with us is an old friend of the show. She is a medical expert, but board-certified invasive cardiologist out of Texas. She is Dr. Fahmi Farah. And Dr. Farah, welcome back to the show.
Thank you for having me. It's always a pleasure to be on your show.
So Doctor, let's discuss a little bit here. What do you owe this to, do you suppose?
I think it's a very interesting study, and I think it has to do with communication. It's just so many different things. Myself being a female cardiologist, I do see the difference in communication styles. And many other female physicians. Like, I think female physicians tend to take the time to listen to their patients and just make that connection where the compliance becomes higher, I believe, with female physicians. Like, say in a similar way, like, female patients, when they go, there's a trend where male patients might not take them as seriously. Young female patients going in with chest pain may be just seen as anxiety and not as seriously taken, whereas a female physician is going to be much more likely to take that person seriously and take them further. So that would explain the hospital readmission rate being lower and mortality rate being lower with female physicians.
Now, from what I'm reading here, I guess the amount of life savings is more pronounced in women. In other words, women patients who see women doctors, the chances of living longer is greater. So what do you attribute that to? Just, I don't know, women's communication skills are better and more apt at dealing with other women?
I think it's not just communication, and it's not to undermine our male counterparts. I'm not saying that males are not bad at communication. I just think that when it comes to women patients going to female physicians, they're more likely to be heard. They're more likely to be taken seriously. And we know this is an issue. It's been an issue with young female patients who go in with things like chest pain. Sometimes they're just not taken as seriously by the male counterparts, whereas a female physician, they will actually take that next step and do the testing and actually take them seriously. So I think that plays a huge role in that reduction of mortality and hospital readmission.
And Dr. Farah, how do you find in your practice as a cardiologist? They're not a GP, obviously, but in dealing with your patients, how do you find that the males and female patients react to you as a female doctor?
I've been blessed. I've had very great experience with both my male and female patients. They trust me, and I think building that relationship with both male and female patients, building that trust is important. It goes a long way, that relationship, because when patients trust in your ability, they are more likely to listen to your recommendations and follow through. And compliance goes up both with something as simple as dietary changes to taking serious medications. So I think that is what makes the biggest difference in terms of reducing mortality, increasing quality of life, and definitely decreasing hospital readmission rate.
So a lot of this is at the empathy factor. I think men just in general are a little more, reluctant to empathize with you and care about your feelings and stuff, where women are probably more so. Is that a part of it, I guess?
I think it is, because, a female is just a lot more nurturing, right? That's just our nature, even when we're not trying to be, that's just how we're seen. And I think patients just feel more comfortable opening up. And, we tend to, in my female patients, for example, and male patients, they're very comfortable opening up about certain things, even their personal lives. And sometimes that social aspect, that personal life, plays a role in how compliant they will be with what you're telling them to do. And so we can't ignore the social aspect. And so, I think it's very important to connect with the patient at that level, both genders.
Yeah, right now my internist is a female, and my one doctor retired. Then the guy that replaced him retired, and this woman has replaced him. And I found, I'm not uncomfortable with it, but I'm not. There's nothing really. I have high blood pressure. Okay, take these pills. You should be fine. Right. And that's about the size of it. But I don't feel uncomfortable with her at all. And I kind of attribute it, and Dr. Farah, and I know this is going to sound weird, but hey, when you're a kid and you're sick, guess who's taking care of you? Your mom.
Yeah, and guess who you're going to?
Right.
Because Dad's going to say, I don't care.
Right. Like, buck up. Do you think that has something to do with it? I mean, it sounds trivial, but it seems to be that would be a little of an effect.
I agree with you. I think as women, from the beginning of time, we are nurturing, as you said, there's that motherly component, there's that sisterly component, there's that wifely component. So all of those tie in with that nurturing nature. And I think that it can open up some patients and make them feel comfortable. And that comfort level is just so important, And going along with the female patient part, me being a female cardiologist, I do get a lot of patients, young female patients, who come to me for a second opinion and sometimes third opinion because they've already been to the emergency department and they've been just told or dismissed as anxiety, but they continue to have their symptoms, and then they would come to me because I'm one of the very few female cardiologists in the area. And, I can't tell you how many times I've actually found bad things like, abnormalities. So it was not something that was correct, that young female patients, they can, when they're having symptoms, they should not be blown off as just anxiety. They warrant proper workup and objective data with evidence to tell them that, hey, this is in fact anxiety. I don't think we can just take a look at somebody and tell them it is anxiety because you're a young female. So that bias, that discrimination definitely exists. It's something we've had to battle with for quite some time, and I think we have a long way to go to offset that.
Doctor, always a pleasure, and continue doing what you're doing and saving lives, and be it male or female.
Yes. Help us out.
Thank you for having me. Absolutely.
Thanks, Doc.
Always a pleasure.